We're 1 week into open enrollment for the ACA marketplaces, and given all of the confusion that has surrounded the Affordable Care Act this year, I thought it would be good to share with you some of the things that we're seeing around open enrollment, what the risks are, and what even some of the good news points are. So let's start with the good news. The fact is, over 1 million people have checked out healthcare.gov, and over 200,000 people have selected plans already, and that's more than we saw at this same point last year. So in spite of all of the confusion and the noise around this, we're actually getting some good news, and we're seeing some of that even at the state-based exchanges as well. That said, what are the risks that we face in this year's open enrollment? There's 3 of them. The first is that there truly is confusion. The second is that the open enrollment period itself is going to be half the time that it was last year. It's only 6 weeks at healthcare.gov. And the third is that the outreach funding has been significantly cut at the federal level. But here are the facts. Exchanges are actually still exist, they're open for business, and insurers are selling plans. In fact, there are insurers selling plans in every single county in the United States, and there are many plans for people to choose from. And in spite of the fact that many of the insurers have had to raise their premiums, most people who buy through the exchange actually receive subsidies. And in many cases, there are some people who will have subsidies that allow them to get a plan for $0. And finally, there's individual mandate, which requires people to buy insurance, is still in place. And even though that's not the main reason that people buy insurance, they actually want health care, it still will be having some effect in terms of getting folks to sign up. So what do we need to watch out for? We need to watch the numbers. The projections are that because of all of these risk factors, there will be maybe 1 million people fewer signing up this year compared to the 12 million that signed up last year. That remains to be seen. We need to watch out for mixed messaging. There could still be confusing messages that come out. But the good news is that with this shorter time period and the fact that many people are motivated by deadlines, and in fact many people are going to automatically renew, we could see some strong numbers coming out of this open enrollment.